Hi guys, today we're going to show you a little bit of home care and how to do a few important stretches that really help your low back and down into the glutes and into the legs. So all the time I have patients ask me or tell me they wish they could take me home and show their spouse how to do these stretches and how to work them out a little bit. So we're going to show you on video here how to do these so that you can try them at home and work and try to keep things loose and take a little pressure off that low back, okay? So the first one is the hamstring stretch. So just the back of the leg, common straight leg stretch. And we've got Ryan here. I'm just gonna run through this and show you how to do this. Now, quick disclaimer here. If you have any knee problems or hip problems, if you've had surgery on it, don't do this at home. Just don't mess with it. If you have any risk of a disc injury or you've been diagnosed with a disc injury, don't do these at home. It's not worth risking hurting yourself. Come let a professional do it. So what I'm going to do though, for just regular hamstring stretch, we're going to bring this leg straight up in the air. I'm holding above the ankle so I'm not below and moving that foot and ankle around. And then this one, the lower hand, I put right over top or just above the kneecap on the quadricep muscles. And that's just going to help so that that knee doesn't bend. We don't want to do that. So we're going to keep this leg straight. And I'm just going to start bringing this up, and Ryan's going to tell me when he feels a good stretch behind the leg. Are we anywhere close, Ryan?
A little bit more.
Okay.
That's good right there.
Okay. So he's feeling it right behind the leg here right now. You might feel it like all the way just behind the knee, like a burning sensation. Some people feel it higher up on the leg, but just somewhere back in that hamstring. And then I'm going to hold that for 5 to 7 seconds. And then I'm going to have Ryan push back down. He's going to give a good kick down, and I'm going to resist him a little bit. Okay, go ahead, Ryan. Push down a little more. And I'm just going to fight him just a bit so that muscle has to work. Good. And then relax. Bring him back up. And I'm going to try to get him just a little bit further, maybe a ½ inch to an inch farther, right about there. Good. We'll hold for 5 to 7 seconds again. Okay, Ryan, kick it on down. Good. Good push. Awesome, and I'm just giving him some good resistance just to make that muscle work. And then there we go. We got him to 90 degrees. So we started just a little below 90 degrees, and now I've got him to 90. If I can get a patient to 90 degrees with this hamstring stretch, I'm pretty happy. That's pretty good for me. And down you go. If they are a dancer or a gymnast or a cheerleader, you'll be able to take their leg way up. But most people are going to be like 45 degrees up to 90 degrees, somewhere in that area. Okay, so I normally do 3 stretches with that, holding for 5 to 7 seconds, good resistance down, and then I move on to the glutes. So, and you do that on both legs, okay? The gluteal stretch, we're gonna bring their leg up, and I get their leg at about 90 degrees from the hip up, and then this is the whole key. I hold the knee here with some slight pressure down, just very minimal pressure down. And again, I'm holding above the ankle. You don't want to turn the foot way in on this. So you hold above the ankle, and I'm going to rotate that in. So I'm not doing any pushing up or down at this point. I'm just stabilizing that hip and rotating that in. So with Ryan, I can get him to about here. You need to feel really good tension and like you're hitting the end point of that rotation. That's the whole key to this stretch. You got to keep that rotation up. And then I'm going to take knee to same shoulder. So we're going straight up, holding that foot or that leg rotated in. Do you feel that in the glute, Ryan?
Yeah.
Holding for 5 to 7 seconds and push out. Okay, Ryan, I'm going to have you say something here. So we're going to come back to the start. I'm going to hold that rotation in again, and then we're going to get the stretch. Okay, now if I let that rotation go, Ryan, what just happened to the stretch?
It just kind of went out of place then.
It's gone, yeah. So the whole key to the stretch is you have to keep that rotated. It's a little tiring. The arm fatigues a bit. That's just the key. So I do 3 stretches with this. I go knee to same shoulder. We have him push back. I get him into that same position. Then I go knee to opposite shoulder, so about a 45-degree angle. Hold for 5 to 7. Is that pulling good, Ryan?
Yeah.
Okay, push out. Just give him some light resistance here. Back to the same position, and then I go straight across, very slowly and carefully on this one. So we're going like knee to opposite hip. You feel that? You do not want to do these fast or put a ton of pressure down. It's just nice, light, easy stretches. Okay, So I'll be honest, you get a little bit of a workout holding that foot, that leg in. So one way to cheat with this, if your spouse is like, man, I'm not doing that again, that was too much on me. This is a bit of a high table, but what I used to do with this is I would get patients into position and I kind of climb up on the table with them and put my knee over top their other knee, but just in the air. You don't lean on that or you'll Charlie horse them. And then I stick my elbow right into my gut and I hold them like that. And then I use my body weight and lean in. So you're not just using arm strength. You feel that?
Oh, yeah.
It's the same stretch. That's just how you cheat a little bit so you're not killing your arm. Same deep stretch. And I'm putting my body weight through my elbow into this hand there and then just guiding it with this other hand on the knee. And then you go straight across, leaning in. Okay, Ryan, am I hurting you with my leg on your knee?
No.
No. If you push down with that knee, though, that hurts. That Charlie horses their other leg. Okay, so hamstring and glute stretches. Again, just be careful with these. The person being stretched needs to communicate with you and talk to you when they get the stretch. Don't do anything fast or jerky, no bouncing. That's how you hurt somebody. So this is just nice, easy, controlled stretches. And this will help just take pressure off the low back. The glute stretch feels awesome. We rarely ever stretch our glutes. And so it's just a really good feeling stretch. And it really does help with the pain. Patients love it.